This is the Climate Health Action, or CHAP, lecture series. This is the second in our series, this time focused on food justice. And we're very excited to have our three speakers that I'll introduce to you in a moment. And I'll be your host. My name is Tess Gessler. I'm a physician assistant with the hospital medicine group at M Health Fairview. And we can go to the next slide. And that will be our agenda in a moment. Essentially, we'll be discussing, what is food justice? Why is it important? And then we'll have our three speaker presentations. So first we'll have Catherine Fleming. She is the CFO of Project Sweetie Pie, and she'll be speaking about food security in North Minneapolis. Then we'll have Ben Rolland. He's from MN 350, and he'll be speaking about climate justice through food systems. And last but not least, we will have Dr. Kate Shafto. She is MD with Hennepin Healthcare and is a regenerative farmer. So we're very excited to have the three of them. And at the end, we'll have an open Q&A session. You can address your questions. Let's go to the next slide. Unfortunately, the version of the presentation that we have does not have our CHAP website link, so we'll post that into the comments. But if you search for CHAP or Climate Health Action Program in University of Minnesota, you'll get to that website. And our next presentation will be June 28th, and we'll be talking about energy justice. So that will be very exciting. And let's go to the next slide. So here we'll have just a bar graph that gives some of the environmental impacts of food and agriculture in a moment. And I'll try not to be too long-winded since we have our three speaker presentations. The food systems that we have incredible impacts. In this case, we see greenhouse gas emissions across a food chain supply. And this is a very difficult to read slide, my apologies, but we have in the green bars land use, brown is farm, orange is animal feed, blue is processing, the red is transportation, the yellow is retail, and gray is packaging. And this is by food item. So at the top, we have the worst of the worst being beef. And at the bottom, we have things like apples, citrus fruits, and nuts. And this just kind of gives a schema of the greenhouse impacts. This is a chart that's available on our World in Data. If you'd like to look at the full website. Next one. And I believe we have the next bar graph, which discusses food agriculture. But in our food systems, 50% of the land use goes into agriculture. About a quarter of our greenhouse gases are a product of our agricultural systems. Freshwater use, 70% of that goes into agriculture. And there's this term called eutrophication, which essentially is regarding pollution by nutrients. Oh, that's our last slide. And agricultural systems contribute 78% of eutrophication of our water systems. And probably most starkly, our biodiversity in our biomass of animals is 94% agriculture, and that's excluding humans. So it's a pretty stark spread of where food impacts our environment. Sorry, Lilith, I hope I gave you the best presentation. We can go to the next slide though. So, and just to give you some examples of, what are areas of food justice, we talk about things such as environmental racism, which includes things like slavery. Unfortunately, even in this day and age, we still have modern day slavery that goes into our food systems. And so we have organizations such as Fair Trade that are helping us to ensure that we have justice in working with our farmers. There are many dietary diseases that are the result of our food choices. And even, looking at the United States, more than half of individuals are overweight and obese. And this relates into many dietary diseases such as metabolic syndrome. This includes things such as diabetes, hypertension or high blood pressure, and hyperlipidemia, to name a few. And environmentally induced diseases also pertain to things, like COPD, asthma, interstitial lung disease that are the result of air pollution, which are a result of our agricultural systems. And this slide that we're seeing is about my passion, which is regarding plant-based diet. I have been personally following a plant-based diet for more than 10 years and would love to share my passion with anyone else who would like to email me. So in that last slide, there was oh, here we go. These are some of the examples of food justice that we discussed. The environmental racism is there. And okay, so my apologies, I'll go back to this slide. So we mentioned dietary diseases, food insecurity, and food deserts are a huge problem in the United States. And despite having very vast food production, unfortunately, there are still areas in which folks don't have access to fresh foods and don't have accessible grocery stores. And pollution and contamination continue to be a concern. Some of the more salient examples being such as the Flint, Michigan water crisis, and unfortunately, things of that nature are still ongoing. And returning to this slide, I shared a number of links. I wish I could share so many more. These are just a few examples of some of the websites that are very helpful and give you kind of an array of different areas in which plant-based lifestyle kind of touches the world. But there is a film at the bottom that is very powerful. The vegan from a plant-based standpoint. And this email at the top of the slide, plantpowerp@gmail.com, is an email where you can reach me if you have any questions and would like to be introduced to more plant-based resources. So without further ado, I would like to introduce our very first of our three speakers, Ms. Catherine Fleming. And as I mentioned, she is the CFO of Project Sweetie Pie, and she'll be talking to us about food security in Minneapolis. So welcome, Catherine, and let's bring up her slides.
Oh, thank you. Thank you, Tess. And I am honored to be on the dais or with this particular panel. Project Sweetie Pie has been working in North Minneapolis for since 2010. So I have a slideshow here.
Okay. Well, Letha, maybe if you end your screen share, we can get Catherine's slides up.
Can you see my screen yet?
We can see them.
Okay, great. Just so the audience knows, I will be talking loosely about the screen, and the PowerPoint will be available to interested parties after the presentation. So If you miss anything, you'll have the opportunity to review the slideshow and the associated links at your leisure. So let's see here. Having little technical difficulties here. I'm sorry, oops, I was trying to move it along here.
No worries.
Okay, well,
I don't think I see the same screen as everyone, so.
okay, well, Project Sweetie Pie, planting the seeds of change. North Minneapolis is going green. Give us a call and learn what we mean. Where once lie urban blight, now sits luscious garden sites. Gardens without borders, classrooms without walls. Access to food, destiny, and of our own future. So Project Sweetie Pie began in 2010 and has been involved with urban agriculture since that point in time. As a matter of fact, we were the authors of the 2014 bill that put the words urban agriculture, that phrase, into legislation. And now the Department of Agriculture has a grant that provides funding for urban agriculture to people across the state. So it's not just focused on North Minneapolis, but it involves most of the state. I'm here to talk about food insecurity in North Minneapolis. The federal government has designated North Minneapolis as a food desert. So what does that mean? The federal government defines that as the distance a resident has to travel to have access to healthy foods. So of course, access is an issue in North Minneapolis for a number of reasons. Lack of major food chains like Cub Foods and Hy-Vee and others who not exactly close by for residents. So even in situations where residents would be within a couple of blocks of a major food store, which is still limited, they have to travel downtown, take a bus and come back uptown, get their groceries from the store, put those groceries on the bus, go back downtown, and then take the bus from downtown to get to their home. So you can see the impact not only of access, but also transportation issues as well. So it's not just a matter of physical access, but in our experience, we've seen that it involves behavior changes. So a number of residents are accustomed to fast foods. So not only is our mission to provide access, but also to provide education, training, and starting at a very early age. So we work with kids as young as daycare centers, as old as more than 70 years old. So we have folks without borders when we're talking about the age diaspora. One of the young people that we were working with, we asked them in a classroom setting, well, where does your food come from? And the first thing out of their mouths was that it comes from Cub Foods. So the disconnect of all of our residents from the earth, from the food source, is another issue that we have to contend with, have to have as an educational and training tool as well. And those are some of the services that we provide to our residents. We have over 21 city lots in North Minneapolis that grows food. 10 of those lots are city-owned lots, and the 11 are private ownership. When we talk about the city-owned lots, of course, our lease agreement with the city says that we have to leave if there's a developer who wants to develop that site. So no matter how much work we put into doing the soil, tilling, growing vegetables, feeding the community, if a better use, which is the definition the city uses, comes up, then we have to leave that site. So we're working on that with a number of food advocates, both government and private and philanthropic, to assist us with changing that paradigm for some of the things that are keeping us from being secure in the sites that we have, and having our residents secure that they can come to those gardens and have the opportunity to get food. We are feeding the community. There's a lot of fast food places in North Minneapolis. As a matter of fact, I think a survey had been done, and there are more fast food restaurants in North Minneapolis than spread across most of Minneapolis in totality. So of course, that's another concern. The cost. A lot of residents do a cost comparison. It's cheaper for them to buy a hamburger at McDonald's than to buy an orange at the store. So we need to change some of those issues. And we're doing what we can with the food we grow in the gardens as well. But we can't do everything, and we need support from so many different areas. So another issue, as I alluded to earlier, was changing the mindset. We've had Worth Co-op, we've had other attempts to bring healthy foods into the neighborhood, and they have not been successful. Why? As I mentioned, the behavior changes that need to occur, and the force of marketing. Our community is marketed with fast foods to the extent that it's overwhelming. So changing that behavior, educating people, training them on how to prepare the food that we've grown and they've harvested from the gardens. By the way, the food that's grown in the garden, unless we are moving it to the farmer's market, that food is free. We do all of the labor, we grow everything, and whoever wants it can come and get it. So that's our gift to the community. We're small, we're relying on grants and donations, but we do what we can with the money that we have, because we want to make sure that our people have some access to healthy foods, and also how to prepare those foods, how to store those foods, and making them aware of how it impacts their health, the health of their children, and future generations as well. So we're working on a number of areas. We're changing behavior, we're changing the community, we're impacting health issues. We are providing more camaraderie. The work that we've done has shown to be cathartic when we're talking about violence. When you have kids working in the garden, they're less prone to criminal or violent activities. So not only from the standpoint of our youth, but also for some of our adults, there's something about connecting with the earth that just kind of calms people down. It just brings about a different approach to things. And we worked with daycare center kids, and they are just so excited, little boys, when they find a worm in the ground or something like that. So just those kind of things get them all excited. And then for the kids to eat something that they've actually grown, I mean, they're running through the neighborhood showing people this tomato that they actually grew themselves. I mean, it's almost like a trophy for them. I'm like, you know, you can eat that. So, but they are just so excited about bringing forth something themselves from the ground. So we're impacting the community in so many different ways. We love what we do. We're primarily volunteers. Let's see, I've been working with Project Sweetie Pie since 2011, and so far we've not gotten paid. So apparently free labor is the best way to go. We do what we can. And there are a number of challenges, governmental, environmental, community, but we are facing those challenges one vegetable at a time. We work with a number of organizations. We have a number of initiatives that we're working with. We do training. We have a recent initiative where we're connecting Black farmers between Georgia and Minnesota so that our kids can be in training and have access to farmland almost year round. So we're working on that initiative. We have an initiative with a juice bar on that's mobile. We have an initiative called the Family of Trees, where we're replanting trees and showing kids the importance of trees and how they impact not only the aesthetics of a neighborhood, but also their health. And if you breathe, then you should be interested in trees. We have another initiative where we do pop-up plant-based food events. So people can learn that you don't have to eat meat. A lot of us have grown up, if you don't have meat, you really don't have a meal. Well, that's not true. And we're showing folks that that doesn't necessarily have to be the case. So I won't take up too much more time. I apologize that I have some technical difficulties with the PowerPoint, but it will be available for those who might be interested. I am available for questions and hopefully have some answers. Or you can connect with our executive director, Michael Cheney, who coincidentally was the 2021 Outstanding Community Service Award recipient from the University of Minnesota, which adds to a number of accolades. The Project Sweetie Pie, Michael Cheney and myself have received over the years. We don't want to blow our own horn, but we're blowing our own horn. And we have at least 20 or so awards from different organizations, private, public, philanthropic, all of the groups across not only North Minneapolis, but the state of Minnesota. And now we're expanding beyond those borders because our people are talented, they're worthy, and we want to make sure that we bring as many opportunities as possible to their doorstep. So we are grateful for this type of gathering with this wonderful group of people speaking on so many areas that are near and dear to our hearts. So thank you for allowing Project Sweetie Pie to be a part of this. And we look forward to speaking with you and the community later on. Thank you.
I'm not sure if I should introduce myself or if I was going to be introduced, but I believe I'm the next speaker. My name is Ben Rolland. First of all, thank you, Catherine, for starting things off. Great. I'm going to also try and share a presentation, so let me know how that goes. Can anyone see this? Nod your head if you're on camera.
Yep.
Great, thank you. Yeah, so I'm Ben Rolland. I'm here as a volunteer with Minnesota 350, and I'm going to tell you a couple of stories. I'm going to tell you the story of how I got involved in food systems work. I'm going to tell you the story of what Minnesota 350 and our food systems team have done and are doing, and I'm going to tell you the story of the Headwaters campaign, which I am the lead facilitator of. And I'll start off with a little background and how I got into this work. So I'm 23 years old, and I've been concerned about climate change for as long as I can remember. But it wasn't really till around 2018 when I started thinking critically about the role of agriculture and food systems in the climate crisis. And I came to this at the time I was studying environmental studies at Macalester College, and I was doing a lot of research for an ecology class about agriculture. And I was learning a lot of what Tess was sharing earlier about the massive impacts of greenhouse gases, the damage to clean water, destruction of land, soil, and ecosystems, and I was getting really concerned. And I'm a very solutions-focused person, so as I was reading and researching, I was really looking for what are our solutions? What can we do to reverse this? How can we build a clean, just food system? And one of the things that really excited me was regenerative agriculture, which Kate is going to be presenting on after me. And I'm not a farmer. I don't own land. I don't have any real connection to farming, but I wanted to know how I could get involved. So I did some Googling. I think I probably searched regenerative agriculture Minnesota. And the first thing I saw was Minnesota 350 and their food systems team. So around 2019, I think summer of 2019, I attended my first meeting back before the pandemic at the office on Lake Street. I was really excited by the people and the campaigns, and I kept coming to meetings. I got involved doing research for a campaign they had on the time to hold Cargill accountable to their promise of reducing emissions by 30%. So I was sort of researching press releases and industry documents for, are they actually staying with this? The spoiler is no, they are not. It's a greenwashing campaign. And I stuck around till the next summer during the pandemic, when I was actually asked to lead a new campaign we were taking on called the Headwaters Campaign, which I'll be telling you more about. I have these two books here. I really recommend checking both of them out. I think the slides will be sent out, but they really helped me make that connection between ecosystem health and human health, and where agriculture fits in there. Now I can tell you a little more about Minnesota 350 and our food systems team. Minnesota 350 is a climate justice organization based in Minneapolis, but with members and volunteers all across Minnesota. We're part of 350.org, which is a global network of climate justice organizations. And let's see, the reason that we're concerned about food systems, right? Why is a climate organization concerned about food systems? Not only what Tess was saying before about the massive greenhouse gas impacts, and I have a stat here, 26% of emissions in Minnesota come directly from the agricultural sector. The real reason is Minnesota is a farming state, right? So that is one of our levers to reverse climate change here and regenerate the earth. Not maybe the same for states like New Jersey or Rhode Island, but for a state like Minnesota, this is kind of our alley. A little more about Minnesota 350. We are a volunteer-led organization. All of our campaigns are being led by volunteers. That's where the energy really comes from. For example, on our food systems team, we have 300 members on our listserv. 100 of these are people who are active and they come to meetings at least once a month, or actions once a month. And for all of these people, we have one part-time staff person working 10 hours a week. So it really, the heart of our organization is volunteers, which I think is really unique. And I think it makes the community so strong, and just a lot of room for new ideas. And I think that's my attachment to that, the volunteer-led model. As far as our mission on the food systems team, our mission, I have it here on the slide: creating a food system that is local, regenerative, equitable towards all who depend on it, and mindful of its impact to future generations. And I also wanted to share a little bit about our role. So our role in this sort of ecosystem of organizations and people working on food justice is, we have the legislative arm. I'll tell you more about that with the Headwaters campaign. We do a lot of supporting other efforts. There have been numerous organizations who have come to us looking for funding for their projects or organizational support. They want to partner with us, have us help promote things to our big network. So we do a lot of supporting others. We're working on building a coalition of organizations working on this, as well as people who are working in the food system, in the food economy, and are champions for a regenerative food economy. We also do a little bit of research. So some of our working groups within the food systems team, we have about 5 active working groups right now. There's a little bit outdated sort of map up on the top right to see how they all interact. It doesn't reflect the podcast team, but what we're really doing right now is helping connect small businesses and food shelves with grant money to have better refrigeration equipment so that they can store food for longer and waste less food. And finally, our newest team, we have a regenerative agriculture team, and they're working with an organization called the Agrarian Trust to establish agrarian commons in Minnesota. And the short answer of what this is it's essentially land trusts to make sure that farmland is being kept as farmland, like Catherine was talking about, with the issues of development being able to take that leased land from the city back out of the hands of people farming it. We don't want that. To get healthy soils, we need land to stay farmed, and we also need access to land. It's really hard to access land, so owning it cooperatively is one model for helping that. And finally, we get to the Headwaters campaign, and this is my baby. I've really been working on this with a local activist, Marita Bujold, who brought these concepts to Minnesota 350 in June, and I was asked to be the facilitator. The concept of this campaign is creating structural change in Minnesota's food system through transformative legislation. And the real reason for this and why we're targeting legislation is the reason our food system is the way it is in America is because of a piece of legislation called the Farm Bill. And this is federal legislation. We don't have much power to change this in Minnesota, but we can create an alternative. And believe it or not, the food system we have is publicly funded. And I'm sure there are plenty of people who would love to call this socialism, but it's how we've been doing things for, as long as there's been a Farm Bill. And a little bit about how this works is the Farm Bill subsidizes farmers to produce commodity crops. So think corn and soybeans. And the reason they do this is to, it's a big part of it is for international trade and that side of things. But the other side is, this is how the US tries to make food affordable to people. And they do it by making it so that farmers get paid so that they can sell crops cheaper than the actual cost of growing them. And there's 2 problems with this. One is it means farmers cut corners and do things in the sort of fast cash way, which is really destructive to the environment. And the other problem is it means that when you go to the grocery store or you go to McDonald's, things like hamburgers, which have those subsidized soy and wheat in them, and things like processed snacks, those are cheaper than actually nutritious food. So the idea here with the Headwaters campaign is we can use public money in Minnesota to invest in a regenerative, just food economy, right? And how we do this is instead of to help farmers compete with those subsidies to grow soybeans and corn, we can invest in farmers and pay them to grow healthy food using regenerative practices. And that then brings the prices down for those foods. And then that's really where this ties into food justice, is all of a sudden we see the price of an orange is now cheaper, or the same as the price of a hamburger. That's really one of the most exciting parts of this for me. We can talk more about this, but just to move things along, where we're at right now, there is a piece of legislation for this, and it's called the Headwaters Community Food and Water Bill. It's in both the Minnesota House and the Senate. We have about 25 to 30 authors between senators and legislators. And what this bill is it's a vision bill. So it's really written as sort of a manifesto, and it's not written in a way where we're really trying to pass it. And you might ask, why would you introduce legislation that you're not trying to pass? you can think of this like the Green New Deal. So it's really, the goal is to get this in everyone's mind, get the public aware of this, get people who work in the food economy aware of this, and get legislators aware of this. And what the goal is that in a few years, we can do what the Green New Deal is now doing, which is breaking up the vision into more digestible pieces of legislation that can pass. So, we're seeing that right now in Biden's recovery plan. There is some of those ideas for green jobs that came out of the Green New Deal. So the vision is we have this radical vision, we make this a household name like the Green New Deal, and then we really go after it in the legislature. Tess, I see you took your mic off.
Yes, thank you so much, Ben. That was a really amazing introduction to the Headwaters campaign. Maybe this is a good opportunity to turn the conversation over to Kate Shafto so she can share with us a bit about the regenerative farming. Do you have any closing remarks you'd like to make?
I would say, please ask me questions about the Headwaters vision. I would love to get into some of these last points here later on. Thank you.
Thank you so much. Alrighty, and let's show Kate Shafto's screen. And Dr. Shafto is an internal medicine provider at Hennepin Healthcare and is a regenerative farmer. He's going to share with us a bit about regenerative farming.
Thank you so much. It is delightful to be with you all today, and I'm very inspired from hearing Catherine share and Ben, and I love what both of you are doing. I know of your organizations and the amazing things that urban farming is doing. I hope to tag off of, as well as I could say a lot more about books. I want to give a 2 thumbs up to Ben's book recommendations. I've read both of them. They're phenomenal. And yeah, this is skimming the surface of a lot of really important topics. So I'll just quickly give my story. As Tess said, thanks for the intro. I'm a internal medicine and pediatrics trained physician. I also did a fellowship in integrative medicine, which tags well into this this whole conversation, because integrative medicine by nature is a holistic, whole person, whole system approach to healthcare. And we are nothing without food, and we're nothing without our environment. So all those things are near and dear to my heart when I think of medicine. But I'm also, as Tess said, a regenerative farmer. Fairly recently, I didn't grow up in an agricultural family, nor do I own farm land, but my husband and I have started a little farming business, and I'll tell you the story behind it. So why I am really involved in all of this is a passion that started, I think, from my youth. I did walk around looking in our garden and exploring where vegetables came from. So I thank my parents and family for that upbringing. But when I was out of residency, practicing at the U, actually, I worked at the U before I came to Hennepin, and I went to a conference called Healthy Kitchens, Healthy Lives. I highly recommend that conference for any of you who are looking for a great conference. It's in Napa in February, and that's a nice time to go to Napa. And that was the main reason I went, but it turned out to be a life-changing and career-changing experience. I learned about the food system as a concept. I learned about culinary medicine, mindful eating, how government subsidies are increasing all the metabolic diseases and the chronic diseases that we're struggling to manage in our medical system. And that really set my path from being a hospitalist to one of wanting to get further upstream. And so I ended up doing a fellowship in integrative medicine. I partner now with a chef who also is an MPH, and her name is Jenny Breen. She's, I'm sure, not unfamiliar to some of you, but she and I partnered to actually come up with a curriculum around culinary medicine for healthcare students. We started with medical students and now have an interprofessional course that we teach through the Center for Spirituality and Healing. And through that journey, I just kept going deeper and deeper through books and other conferences and seminars, and then talking with people and getting to know my local co-op and starting to recognize that I had a choice where I would purchase food. And I want to be sensitive to the fact that I know not everyone does, as Catherine shared. And I I'm extremely grateful for the choice and the privilege that I have to be able to choose where I procure my food. And I realized too that I wanted to know more about how this food comes about and the connections between the process of farming and food cultivation and health. So I ended up stumbling into a program with Big River Farms, which is under the Minnesota Food Association and the Food Group. And they have an organic farming training program. My husband and I applied and were accepted to that program, and we've completed 2 seasons with them, and then and have so many tools and amazing experiences. We farmed a 1/4 acre for 2 seasons, and through that experience learned that we wanted to do more than just follow organic practices, and we also wanted to do it closer to home. We were training at their farm, which is in Marine on St. Croix, and that the drive out there felt a little bit ironic and a bit counterproductive in terms of our efforts to improve the environment through organic farming. So we've moved things closer to home, and we've now cleared a number of patches in our city lot in South Minneapolis to start a little micro farm, which we are calling the Generous Garden. We've literally just made it an LLC in the last month, working on an Instagram account. Website will be forthcoming, but that's kind of the progression of how I went from being a doctor who cared about food but didn't really know much to knowing a lot more about food, and now really going deeper into the agricultural side of things. So to introduce regenerative agriculture or farming, there are 5 principles, and these are things which I think are nicely represented in this little graphic. And interestingly, this graphic comes from a healthcare organization called Healthcare Without Harm. And I put the link there. So really awesome that Healthcare Without Harm as an organization is tapping into the realities of agriculture and educating their readers and followers on this principle. So minimizing soil disruption, keeping the soil covered with plants or keeping roots in the soil, planting diverse crops, minimizing to avoiding eventually synthetic chemicals, and then planned and rotational grazing. So the animal manure actually has a really key role in nourishing the soil and having it be a cycle of regeneration, actually. And this is something that illustrates what tilling does. So mechanical tilling, I'm not talking about like turning over soil with a pitchfork or with a shovel or even like surface level soil tilling, but the really hard, aggressive tractor-based mechanical tilling releases carbon dioxide and water into the atmosphere. Regenerative practices, which keep roots in the ground, as that picture shows, and does not disrupt them with repeated tilling, keeps and actually sequesters carbon into the soil and retains water. It reduces runoff. There's numerous things that tilling the soil and the industrial agriculture practice on so many millions of acres in our country and around the world are doing to contribute to climate change. So that release of tons of carbon into the atmosphere, the disruption of the fungal networks and the soil microbiome. I could get on a really deep rabbit hole about this because soil health is really akin to our microbiome health. I think of the soil as having its own microbiome, as does our gut microbiome, which is increasingly recognized as really the core and root of our health. When we till and disrupt the soil, it destroys the life of the soil, that living organism of those fungal and microbial networks, the minerals that are there, and it doesn't allow those soil networks to continue to feed our plants. So you can technically grow plants in really unhealthy soil, but those plants are just like an empty shell of really what they could be if grown in really nourished soil. And then the impact on water and air, but water is that tilled and heavily chemical laden soil is not able to hold water well. And so it makes runoff more likely, polluting streams, losing topsoil. And there's a couple of, I didn't put it in here, but a couple of good films. One is called Kiss the Ground, which is where that graphic came from, which I highly recommend. And it's a sobering wake-up call to the dangers of ongoing industrialized agriculture. And so how do I blend medicine, my career in medicine, with farming, food, and climate justice? I make it a central part of every conversation with every patient. So I currently work in a setting where I have clinic 2 days a week with a pain clinic here at Hennepin, and I do an integrative pain management approach. So I take a whole lifestyle approach with every patient, and I always talk about food with them. And so food being the foundation of health and gut health is one of my favorite connections to make with folks. I don't always come right out of the gates when I talk with people about food, saying that, you know, where their food comes from directly influences their gut health, but with time and with relationship, we can get there. I try to incorporate food education and counseling in every visit. So I always have some sort of a food plan or recommendation or suggestion with patients. I do group medical visits, and that has been a really fun model where I'm able to see a group of patients, and I have a current 8-week program where I do a holistic approach to pain care. And group medical visits are billable. They are recommended by Medicare, Medicaid as really economical and efficient ways to do patient care. So it's not like we're gaming the system to do group visits. It's actually a really legitimate and couple decades old model of patient care that we just don't operationalize enough. But in that, we can do more education. We can do experiential activities with food. And even I have a thought, we're doing our group visit in person this next round, and I'm hoping to be able to bring in some plants, to have people plant their own little pots of herbs or some vegetables as a part of the series. I'm heading up a vending machine transition project at Hennepin because I think it's a moral dissonance to have Pepsi outside of the diabetes clinic and every other clinic, as well as all manner of the commodity-driven subsidized snack foods that we have in vending machines. So I'm working with some providers to make a transition toward healthier options, as well as I'm hoping to work on a move toward compostable and more recycling. Recycling isn't the answer, but it's better than just trash. So that's a small project I'm working on also. And my final 2 ways of implementing this are in medical education. So 2 days a week I'm in clinic, and the rest of the week I'm active in teaching, and I'm a course director in the medical school for a 1st and 2nd year course on clinical thinking. But outside of that, I'm also consulting with the University of Minnesota Duluth Medical School campus on incorporating food systems, equity, and social determinants of health into their curriculum, which has been really exciting so far. I teach a 1-credit course through the Center for Spirituality and Healing, usually once a semester for 6 weeks. And that's called Food Matters. That's the course that I designed with the chef who's also an MPH. His name is Jenny Breen. And we work together doing other community-based consulting in this space too. So my future vision is to combine these things into one center or farm where they all come together. Oops, there it is. Where a farm clinic that trains doctors and farmers, or farmer doctors, doctor farmers, to make these connections for both patient care and for the earth. And ideally, we'd involve our patients and staff and everyone else who comes to that place in the cultivation of vegetables and food for the community. A couple of links that people can look at later around other doctor farmer work and food healthcare integration. Some of my favorite models and inspirations. And then what you can do today, maybe this segues into some Q&A, support local farmers and farms, grow food even in a pot. Herbs do really well this way, so do greens. And then demand that your organizations, whatever you are part of, your healthcare organization, your residency program, your community group, your neighborhood association, takes food and the food system seriously. Maybe working on getting chemicals out of lawn care in your neighborhood so that you can grow food safely without Roundup coming into your water or soil. Just an example. Connect with a farmer's market, volunteer with urban farms like Project Sweetie Pie, the Generous Garden, the project that my husband and I are working on. We would love help. If you're interested, please reach out to me. We're just getting started and it's a big lift. So happy to take questions, and I will stop sharing my screen and we can move on.
All right. Well, I want to thank all of our 3 speakers today. And if folks would like to post their questions into the chat, I don't believe we have the ability for folks to unmute themselves. But if you would like to post your questions into the chat box, that would be most helpful. And I guess, Kate, since we have you, you kind of mentioned this already, but one question would be, if you can write a syllabus for our medical school at the University of Minnesota, what things would you like to teach?
Hands-on cooking education. That is one of the most powerful ways. When we experience something, we learn it. So the fact that I know how to cook means I can tell patients in 5 minutes how to make their own salad dressing, how to chop up vegetables and roast them. I give patients instructions, recipes all the time. And it's because I went to that conference in 2014, Healthy Kitchens, Healthy Lives, which is a hands-on culinary medicine conference. So I would put hands-on cooking in the curriculum, which I've offered to do for a couple of years now, which has not been accepted yet by the medical school. We were able to do that with UMD over the last year, on Zoom even, and students had a great response. I would also include the food justice, food systems, and food access education, because without that, you can't appropriately navigate this with your patients. And then I would zoom away or move away from the micro focus on minerals and vitamins and calories and all this micro level kind of math that is the science of nutrition. It has a place, and I'm not saying it's not important, but I don't think doctors need that to the degree that it's addressed in medical school, and more a focus on the food system issues and the diets that have been shown to be sustainable and good for humans and good for the earth.
I
short
highly
answer.
agree with you personally.
Thanks.
And Ben, if you could develop a syllabus for our medical school, what sorts of things would you like to convey?
That's a really great question. And I was thinking about this coming in, and I was thinking that what I would probably choose would be a food history class, but one that goes back farther than we normally think. I feel like a lot of food innovation and agricultural innovation is miscredited. All of the foods that we eat today were cultivated or domesticated by indigenous cultures. Same with all of our methods of preserving food: canning, drying, salting, and freezing. Those are all technologies invented by indigenous cultures. And as you look around and we talk about regenerative agriculture, a lot of this is really moving away from and fermenting. Great, Kate. Yes, all of them.
I had to put it in
it's pretty much everything, but I don't know, freeze drying or some kind of wacky stuff we've come up with in the last 100 years. But yeah, I think it would be great to see credit where credit's due there. And also just learning about these technologies is so important, since a lot of what we see in regenerative agriculture is actually using these practices like no-till agriculture that were the norm before this sort of Western industrial system took over. So I'd love to see that. I'd also love more classes about like culturally relevant foods. I feel like, I've read a lot about how food and nutrition information, things like the food pyramid and myplate.gov really focus only on Western foods rather than more culturally relevant food.
I think that would be a really great addition to the curriculum, and it's kind of fun to dabble in things like making your own pickles, for example. So I think that would be a really wonderful thing to add to the curriculum. And then I'll pose the same question to Catherine. If you were to develop a syllabus for the medical school, what would you like to convey?
Oh, let's see, like Ben said, that's a great question. I take a couple of approaches. One, probably more pragmatic in the sense that our experience has been that there are a minimum of 4 different groups or departments across the university that are focused on agriculture. So I would like to see the joining of those different departments for a concentrated focus, for a financial focus, for information and educational focus, to leverage all of that amazing knowledge across those different groups into a swell of information and advocacy to our elected officials as well as to the university staff. So I would love to see that different departments form this mega group that would, I don't want to say attack, but would go after our corporate partners and others for their support, not only from a financial standpoint, but from a political standpoint as well. So that would be one. And then secondly, what we've tried to do at Project Sweetie Pie is we had some pushback from some of the young people who were said, oh, I don't want to do any farming. I mean, we're not slaves anymore. You know, we want to get away from that history. So what we've done is shown them how agriculture, degrees in agriculture, education in agriculture can morph into so many different areas, including information technology, science, marketing, and all of the other tentacles that agriculture touches. I mean, we all eat. Everything starts with agriculture, and showing them those linkages and the opportunities that they have from learning that has been both a joy and has produced a number of our graduates moving on to degrees in agriculture. Divine Izzy, Adam. I mean, there's just a list of kids who started out with Project Sweetie Pie when they were just preteens and moved on to stayed with us or came back to us through high school and college, etc. And now work with us and morphed into different jobs with the school system and things like that. So watching that progression and that growth has been one of our pleasures. And then lastly, our approach is that we believe in what I guess we could call circular agriculture. And that is, we did a project called Let's Talk Trash. And what that means is there's no trash. We should be able to reuse everything. There is no trash. The concept of trash and that verbiage that's in so many state documents and wording and things like that, we want to move away from that. So our circular approach is that there is no such thing as trash. So that's what we promote and talk about with our kids, as well as the elders and adults who work with our organization. So those would be through 3 or so areas. I'm sure there's more, but that come to mind right away. So thank you for that question.
And I think you all sort of spoke about some skills that we should have, but I guess, Catherine, what are some skills that you think, we would start with, to pursue food justice?
I guess, and thank you for asking that, because that moves me into how we connect with the community. We use an approach of making it personal, not from the standpoint of being adversarial, but personal from the standpoint, people want to know, well, how does it impact me? How does this affect me? People are busy. They have issues that they're dealing with, financial, emotional, all of the spectrum. We relate climate, food, justice, and security back to the everyday citizen. So our ability to do that is what's allowed us to connect with the community, which allowed us to be recognized by different organizations. So I think it's critical that when we're talking about the community, with no air quotes, that we make it personal. how does this impact you on your day-to-day life? How does a lead poisoning affect your children? How does the soil outside your building where boys are playing, how does that impact your child? How does the lead paint impact you? How does all of these things impact you, John Q. Public, Kanisha, Taiwan, whoever? How does this relate back to you? So that's been our focus, and that's what we believe is one of our most important attributes at Project Sweetie Pie, and we continue to move in that direction.
And I just want to point out in our chat, Dr. Shafto shared the souschef.com to promote Indigenous food. And Jessica posted in our chat, what do we think of some of the meat substitutes, for example, Impossible and Beyond Burger, which I have my own opinions, but I'll ask our speakers. I guess Catherine, since we're focused on you,
since I'm on the spot here. Well, to be honest, I've not tried any of those. I stick with the plants, so I really can't comment from an experience perspective. I do have concerns about the name that says Impossible, so I'm not sure how that's going to work. But barring any of the marketing efforts, I really can't comment because I've not partaken of any of those options.
Okay. Ben, how about you? Have you tried any of these options or had any opinions?
Yeah, I can talk a little bit. So I actually have tried Beyond, I think it was Beyond Sausage. I think I tried it at a Dunkin' Donuts at the airport one time. It was okay, but my thoughts on all this are, I think if you've seen the price of these, they're much higher than the meat alternatives or than the actual meat, which is unfortunate. And if I were in charge, I think I would be more focused on, rather than trying to replicate meat for the consumer taste, trying to change the consumer taste so that people are more comfortable eating other protein sources, plant-based protein sources. There's a ton of meat substitutes that have been around for thousands of years, like tofu and mock duck. So I think getting people more familiar with those is certainly one way, but I think getting people to eat less meat, so it's certainly a noble cause, but it's not the way I would do it.
And Dr. Shafto, what are your thoughts?
I appreciate Ben and Catherine's responses both. I have not personally tried it, and I wouldn't be inclined to, frankly, because of how highly processed it is. So that's the concern I have, is that it's no longer those ingredients in their whole form. And our digestive systems know how to deconstruct ingredients from their whole form with, modifications like cooking and like chopping and steaming and roasting and all those things. But when they're ground down into powders and then reconstituted and added with chemicals, and I don't think that does any favors to our gut microbiome, to our nutritional status. So I would encourage people, like Ben said, to pursue other sources of protein. There's fantastic proteins, and I think it's great to make your own veggie burger. And there are definitely restaurants that are serving veggie burgers, just for real veggie burgers. Like they have quinoa and lentils and tofu and chickpeas, and then some mushrooms and some mustard and maybe some ground flax to hold it all together. Great. And that's at least a bunch of whole ingredients that aren't ground down, reconstituted, and processed into something that is supposed to look and taste like meat. So that's my very biased opinion about it. I'll admit it. I think the more we can get back to whole food, the better.
Absolutely.
Doesn't mean they all have to be whole, but like the real version, back to nature. Maybe that's a better way to put it.
And I'll throw my opinion into the ring. I have actually tried both of these meat alternatives, so to speak, and they are delicious, I have to say. But they are, as Dr. Shafto pointed out, they are processed. But I think for people who need sort of a segue into, eating fewer animal-based products and having more plant-based products, I think they're an excellent segue because they are so convincingly like a genuine hamburger, and you avoid the things like any exogenous cholesterols, and they have fiber, and so I think for that reason, certainly over like a meat burger. That being said, as has been pointed out, the meat burgers are unfortunately very heavily subsidized, and so they're very cheap. And so I think that's one of the the challenges that we're facing. And we have some great comments here. We have a comment by Tree. I apologize if I'm mispronouncing your name. The best burger he's had is without meat. Brenna is asking, what are your suggestions on how to have conversations encouraging people toward whole foods and plant-based diet that isn't shaming? And I think that's a really great question. Maybe we'll start with you, Dr. Shafto.
Oh, sure. Yeah, I do this a lot every day, actually. And I, I think our language is a really important way we can meet people where they are and not be shaming. And so I don't use the term plant-based because I think it can be confusing. I also try not to use the word whole foods because then they think of the store, and I don't want to convey the message that to eat healthy, you need to shop at Whole Foods. So I talk about foods in their whole form, or plant forward, plant rich. I will say I think there is a role for animal foods in people's diets, those who need them, for various vitamin deficiencies. Iron can be a particularly difficult vitamin or mineral to obtain from the diet with strictly plants for some people. So I have seen the role of animal products, and I always advise for those animal products to be appropriately sourced and cultivated, processed, so that they aren't harmful to the environment. So anyway, that's just my take on plant-based versus plant-rich, but always mostly plants. And so I try to just ask people what plants they eat. And that can be a challenging question for some people because they think only vegetables are plants. So just kind of having some dialogue about what plants do you eat? How do you feel when you eat meat? How do you feel when you don't? Have you ever explored other options for proteins? Do they know what other things are full of protein? So I think just asking a lot of questions and trying to use language that's inviting and even exciting, like delicious plants, or have you ever had roasted vegetables? They're delicious. And I think our personal excitement and example can be a real connecting point for people.
Thank you so much.
So I have one comment.
Yes.
Some of our pop-up vegetarians have used a little bit of subterfuge in that they have plant-based items available, and people want to try them and say, oh, this is great. What is this? And then the explanation, because a lot of folks have a preconceived notion about how plant-based items taste or don't taste. So that's been one approach. And as someone who has worked as the IT manager at Koch Industries for the Koch brothers, as well as Cargill most recently, then I am familiar with how animal-based products are a corporate driver in so many different ways. But back to the question, our folks have used that and it's been very effective. I won't say they were tricked into it, but they were offered that option, and so far they've not had any complaints. They've had people who were thoroughly surprised at how great some of those items taste and could not believe that it was just plant-based.
Yeah, I've had a similar experience. So I kind of challenge everyone to, try a few of those alternatives and maybe you find something that you like. And I apologize that there have been a lot of comments. I don't think I've addressed all of them. But I think at this point we kind of have to make our closing remarks. So I want to make a last plug for our next panel, which will be June 28th, and that will be for energy justice. And I want to thank all of our panelists. Thank you, Catherine, Ben, and Kate. It's been a pleasure talking to you all, and we hope you'll be back sometime.
Thank you so much.
Thank you. It's been great.
Thank
And
you,
thank you to
everyone,
the
for
panelists.
coming.
I've learned a lot from this participation. So thank you to all
Me
of you.
too. Yes, thank you,
Yeah.
Catherine. Thank you, Ben.
Yeah, thank you
Appreciate
all.
all your work. Okay, take care, everybody.